Hello everyone, welcome back to my YouTube channel. My name is Juliet. I'm a staff nurse in a nursing home and I'm interested in older residents. So in today's video, I will be talking about decision making in older residents. Reason being that when I started my career in a nursing home, so many things were confusing, and one of them was the kind of decisions they made when and how they escalated residents' care needs. I found it very difficult to understand, and I'm hoping that with this video it would assist someone who might be in my position. In older residents, there are different goals of medical care. So one of them can be to prolong life. Another one is to provide preventative treatments. Another one is to maintain their function. So how do we prolong life? So we have some residents who are on active treatment. What it simply means that whenever there is an acute illness or concern, their care needs to be escalated. They need to go to the hospital for urgent or emergency treatments. Preventative treatments are like giving residents anticoagulants because you want to prevent deep vein thrombosis. So there are different things that can be done. You can give residents prophylactic antibiotics in order to prevent recurrent UTI. And also, residents can also be looked after by maintaining their function. That's one goal of medical care. So that's where you have the occupational therapist coming in, the physiotherapist also coming in to support the residents. However, this kind of care is disease centered, and we cannot constantly rely on make decisions based on the residents' diagnosis and their disease. It's very important to involve residents in decision-making process because residents might also have non-medical goals such as maintaining their comfort, having a good quality of life, and having their values respected. As people age, the likelihood of care interventions having benefits is less, and the risk and the burdens that is involved in any care intervention, it's higher than the benefits that is involved for all the residents. So that is why it's important that decisions that have been made is not only based on the disease, but it's also based on the residents' preference, their values, and their goal. So it is very important to focus on options and strategies that increases the likelihood of the benefits, reduces and minimizes the risk involved in that treatment or any burden it can pose on the residents, such as increased confusion. So informed consent has to be obtained in every care intervention, especially the ones that have a significant risk involved. So that is why before a decision is being made, the nurse is expected to consider the resident's ability to partake in the decision-making process. If the resident is unable to understand information being provided, retain the information. That means the resident is able to remember what information is given to them, weigh up the benefits and the consequences of their decision, and then make a decision and communicate it to the nurse. That means the resident, if the resident is able to do that, it means the resident has mental capacity. If the resident is unable to do that, it means the resident does not have mental capacity for that decision. If a resident has mental capacity, it's important that the nurse respects the resident's decision because failure to do so is termed an assault. If the resident doesn't have mental capacity, the nurse has to then ascertain, is the resident having a next of kin? If there's a recorded next of kin, that means you need to confirm, does the next of kin have lasting power of attorney, which means that the next of kin has the right and authority to make decisions for the residents. So you've confirmed the resident has a next of kin who possesses the lasting power of attorney. The next step is to confirm, is this lasting power of attorney for their welfare or for their finances? What's more important to us is that they have a lasting power of attorney for the welfare, that is their health. So if they do have it, it is the responsibility of the lasting power of attorney personnel to make decisions with regards to the health care of their residents. So as nurses, the decision made by the lasting power of attorney needs to be respected. What they say, it's more important than what you think it's that should be done for the residents. What am I trying to say? If there is a medical situation and there's a decision that needs to be made, the lasting power of attorney needs to be contacted, and we need to get the permission from them before any decision is being made. However, if as a nurse you have concerns that the lasting power of attorney is not making decisions in the best interest of that residents, then you can raise it up with a social worker, or you can raise it up with your manager, that you have concerns that these decisions don't seem to be in the best interest of their residents. In the nursing home, we have 3 forms that support healthcare professionals with decision making process with the elderly people. They are the respect form, which is the recommended summary plan for emergency care and treatment; TEP, which is the treatment escalation plan; and do not attempt resuscitation. I pronounce it badly, I know. Then, so these forms are very important. With the respect form ideally needs to be done while the resident is able to make decisions about their care needs. And what happens is the doctor would discuss with the patients about their prognosis, find out what is most important to the patients, what matters to the patients, what kind of treatments do they want. Do they want to be treated in the hospital? Do they want to remain in an environment such as the nursing home where they can be nursed comfortably? And what basically matters to them? What are their wishes with regards to when their condition deteriorates? So the respect form is very important because it supports healthcare professionals to make a decision where there is an emergency situation and the residents cannot communicate their needs and their wishes, probably because of impaired cognition, or at that point they're not in a position to communicate what they would want to be done. So if the resident is unable to communicate their wishes, the next of kin can always be involved. The GP would contact the next of kin and ask the next of kin, what do you think your relative would want in such a situation? Then based on what the next of kin knows, would tell the GP, I think mom or dad would want to be kept comfortable where she is, and whatever is written on the respect form would guide the healthcare professionals to make a decision. So the respect form is not legally binding, which means that it's still up to the healthcare professionals to decide if to respect it or if not to respect it. So if the healthcare professionals doesn't respect the respect form, what it means is they need to be able to provide reasons why they decided not to follow the respect form, and those reasons needs to be valid. So with the treatment escalation plan, this is mostly seen when residents are on palliative care and their condition is deteriorating or they're approaching end of life. So basically, both active residents for active treatments can have a respect form, but when it comes to end of life care, respect form can be available, and also they should have a treatment escalation plan which clearly states that they want to be nursed in the nursing home, and they do not want unnecessary hospital admission except maybe there is a fracture, and if needed. Then you have a do not resuscitate form. I'm still pronouncing it wrongly, but I don't mind. So this form basically tells the healthcare professionals that should the resident's heart stop or should they stop breathing, it's not, they shouldn't perform chest compression, defibrillation, because the chances of it being profitable, the chances of it being of a good outcome to them, it's very low, probably due to they having different conditions that is resulting to the death. And also performing resuscitation can be very distressing for the family members, and also it can also cause internal damages like breaking the ribs. So these are the forms that we use to guide our decision making process in the nursing home. I just want to mention this. If you're in a nursing home and you're finding it difficult to make a decision, it's very important that you seek for support from your colleagues. So you are hardly going to be the only nurse on shift. You might have 2 units or 3 units where you have other nurses on shift with you. You have the registered manager who might be a nurse. You have a deputy manager who might be a nurse. Definitely one of them has to be a nurse, and you can always seek for support from them. It's important you do this because if you fail to make a good decision, you will be asked, who did you ask for support? Did you ask for any support? So if you doubt the right decision to make, ask for support. You can call 111 for support if you are not sure of what step to make. Probably it's late at night and you need an external person to support you with your decision making process. I hope this video has been helpful, and if you like this video, kindly share and comment, and also subscribe to my YouTube channel. Thank you.